The lymphatic system is the network of vessels through which lymph drains from the tissues into the blood. Lymph is a whitish fluid made of white blood cells, mainly lymphocytes, which are the cells that attack bacteria in the blood. Lymph nodes are small, roundish structures in the body. They are located in clusters near different parts of the body, such as the neck, the elbow, the armpit, the groin, the back of the knee, and the chest. These lymph nodes produce cells that help the body fight infection. They also take in lymph fluid and filter out any harmful substances, such as bacteria or cancer cells. When bacteria enters the lymph nodes through lymph fluid, the nodes begin producing more infection-fighting white blood cells. This causes the lymph nodes to swell up. The lymphatic system is similar to the circulatory system, as they both contain vessels branching out all throughout the body that transport fluid. As the blood circulates around the body, lymph leaks out from the blood vessels into the body tissues. The lymph bathes the cells of the body and cleans them, getting rid of anything harmful. The lymphatic system includes the tonsils, adenoids, spleen, and thymus. The tonsils are two small masses of lymphoid tissue in the throat, with one on each side of the root of the tongue. The adenoids are a mass of enlarged lymphatic tissue between the back of the nose and the throat. The spleen is an abdominal organ involved in the production and removal of blood cells. The thymus is a lymphoid organ found in the neck of humans that produces T cells for the immune system. T cells are a lymphocyte produced or processed by the thymus gland and actively participate in the immune response. These attack invaders inside of the cells. And B cells are a lymphocyte not processed by the thymus gland and responsible for producing antibodies. These attack invaders outside of cells. One of the more well-known organs in the lymphatic system is the tonsils. The tonsils trap in the bacteria or viruses entering your mouth to keep harmful substances from reaching your throat. When they take in bacteria or viruses, they swell up, which is a condition called tonsillitis. The tonsils swell while lymph destroys whatever was found. Some people have acute tonsillitis, which is an infection of the tonsils caused by one of several types of bacteria or viruses. Chronic tonsillitis is a persistent infection of the tonsils and can cause tonsil formation. The near-constant infection of the tonsils causes a calcified material to form in the crevices of the tonsils. In cases of chronic tonsillitis, some may have their tonsils removed. The surgical removal of the tonsils is called a tonsillectomy. It is possible to live without your tonsils, but doctors don't do them as often anymore. Tonsillectomies are the second most common surgery for children, although nowadays the criteria one must meet to be eligible to get a tonsillectomy is much higher than it was in the 70s or 80s. Another reason the tonsils may be removed would be to help improve sleep-disordered breathing, or for those who have abnormally large tonsils that may cause complications. There is a small disadvantage to the lymphatic system. Since the lymph vessels reach every part of the body, it can help with the spread of cancer. If the lymph picks up cancer cells too big for it to properly destroy, there is a chance that it can carry it throughout the body. When someone gets cancer, they initially have one tumor that starts to form. Tiny cancer cells break off of this tumor and either enter the bloodstream or the lymph vessels. These circulate throughout the body, and some of the cancer cells are destroyed by the lymph and white blood cells, but some slip past the defenses and infect other parts of the body. This is how someone can initially start off with something like breast cancer and wind up with a brain tumor. If the cancer begins within the lymph nodes, the nodes will have to be removed. The more nodes are removed from your body, the less they can cycle properly. If you had a tumor in the nodes located in your legs and you had them removed, then whenever lymph would flow to that part of the body, it'd have nowhere to go. This causes a buildup of lymph called lymphedema, which there is no cure for. Lymphedema causes swelling in the area of the affected lymph nodes, mostly in the arms or the legs. This swelling is very painful and can complicate mobility. The only way to help ease the pain is to compress the swelling. In conclusion, the lymphatic system is crucial for one's health, and without it we would die from otherwise preventable illnesses.